When most people think about creatine, they think about muscle first. They think about the gym, building strength and muscle mass, and for good reason. Creatine came to prominence and notoriety primarily through the fitness and bodybuilding world. But over the past few years, scientists have been asking different questions about its potential. They wanted to know, can creatine help the brain? And more specifically, could it play a role in Alzheimer's disease or other neurologic conditions? Now, before I dive into this deeper, let me say clearly, this is not a cure. It's not a proven treatment, and this isn't something I'm encouraging anyone to try with a loved one without talking to their doctor. But there was a small human trial published in 2025 that deserves a careful look. The study was titled Creatine Monohydrate Pilot in Alzheimer's, Feasibility, Brain Creatine, and Cognition. And it was done at the University of Kansas Medical Center. And it was important for a big reason. Until this study, all of the Alzheimer's research on creatine to date had been done on animals, mouse models, lab studies, biochemical theory. This was the first actual human trial using creatine in patients with Alzheimer's disease. And in the study, here's what they did. They enrolled 20 patients, average age about 73 years old. All of them were diagnosed with Alzheimer's. Most had biological markers confirming true Alzheimer's pathology, and they gave them 20 grams of creatine monohydrate per day. Now, that's a high dose relative to what most people take in the 3 to 5 gram per day range. This study used 20 grams daily, split into 2 doses over the course of 8 weeks. And more importantly, this was not a placebo-controlled trial. Every participant took creatine. This was what's called a single-arm pilot study. This was a let's see if it's doable and what happens kind of study. And here's what they were primarily looking for. Number one, is it feasible? Can patients with Alzheimer's actually take this consistently? Number two, does supplemental creatine actually increase creatine levels in the brain? And number three, are there any signs of cognitive change with creatine supplementation in this small group of patients with Alzheimer's? So what did feasibility look like for this group? Well, it turned out that 19 out of 20 participants took at least 80% of their doses. That's actually pretty impressive when you think about it. Not surprisingly, there were some mild side effects, some cramping, some GI upset, but no one dropped out of the study. Overall, lab work was stable. There was a rise in serum creatinine, which we expect with creatine supplementation, but no serious kidney issues emerged from this trial. So from a practical standpoint, it was doable. That matters a lot, particularly in patients with some level of cognitive decline. Now, here's where it gets interesting. They used something called magnetic resonance spectroscopy, basically a special MRI technique to measure creatine levels in the brain. And after 8 weeks, brain creatine levels increased by about 11%. That's significant because one of the theories in Alzheimer's disease revolves around the idea of brain energy metabolism impairment. The brain is extremely energy hungry, and just like muscle, it runs on a cellular energy molecule called ATP. When cells expend energy, the cellular battery drains down. Creatine subsequently acts to recharge that cellular battery, regenerating more ATP. So if brain energy systems are impaired in Alzheimer's and supplemental creatine improves cellular energy handling, you can see why researchers have become more interested in that potential. Now, does increasing brain creatine automatically mean improved memory? No, not necessarily, but biologically it makes sense to investigate. So what about cognition? Well, they used the National Institutes of Health Toolbox Cognition Battery and the MMSE, or the Mini Mental State Exam. The mini mental state exam didn't change significantly. That's important to note, but on some of the more detailed cognitive measures, there were improvements in total cognition, fluid cognition, working memory, and oral reading recognition. Now, that definitely sounds promising and it opens the door for hope. But again, this was a small study, only 20 people, and there was no placebo group as a comparison to the group taking creatine. And when you test people twice over the course of 8 weeks, sometimes scores improve simply because they've done the test before. That's just called practice effect. The authors themselves acknowledge that these findings are preliminary, and this study doesn't prove efficacy. It suggests a signal, and that's different. Another interesting finding, the increase in levels of blood creatine correlated with increases in brain creatine, and brain creatine increases correlated with improvement in one of the reading measures. That suggests a possible biological link, but again, correlation isn't proof of causation. This is hypothesis generating data. Now, let's zoom out for just a minute and ask, why does this matter? Well, it matters because Alzheimer's disease at its core isn't just about plaques and tangles, the tissue pathology that we see under the microscope. It's also about energy failure in the neurons, mitochondrial dysfunction, oxidative stress, inflammation. Creatine plays a role in cellular energy buffering. In animal models of Alzheimer's, creatine supplementation has been shown to improve mitochondrial function, reduced amyloid burden, reduced tau pathology, and improved cognition. But animal studies aren't necessarily representative of human outcomes. That's a lesson that's been learned in medicine many, many times over. So what do we really know right now? Well, we know creatine can increase brain creatine levels in people with Alzheimer's. We know it appears feasible and reasonably well tolerated over 8 weeks at high doses within this small group. And we know there were signals of possible cognitive benefit in a small, uncontrolled trial. What we don't know is whether creatine slows disease progression, whether it improves meaningful daily function, whether lower doses of creatine would work just as well, whether long-term use is helpful in this population, whether it works in earlier stages like mild cognitive impairment, and we definitely do not know if it has an actual application in the role of prevention of Alzheimer's. Now, here's where I want to be careful. If you're 50 or above and healthy, you're strength training and you're using creatine for muscle preservation and performance, that's a completely separate discussion. There's solid data supporting creatine for muscle health and aging. But when it comes to Alzheimer's treatment, researchers are at the very beginning of exploring this. This was a pilot program. The authors themselves say larger placebo-controlled trials are needed, and they're right. So what would I tell a family member of a patient with Alzheimer's asking me about creatine for their loved one? I would say this early research is interesting. It appears biologically plausible. It appears reasonably safe in the short term, but it's not an established therapy at this moment in time. And any consideration of acting on this information should definitely be discussed with the patient's doctor, especially if there are kidney issues or other medical conditions which often come to light with aging. Now, here's a broader question some of you may be wondering. What about prevention? What about people in their 40s, 50s, 60s? Unfortunately, we don't have data showing creatine prevents dementia. We have some indirect evidence suggesting creatine supports brain energy, metabolism. We have some data in sleep deprivation, traumatic brain injury models, and in aging. But prevention of Alzheimer's, to date, that has not been demonstrated. This is all very pertinent to me. Like many of you, we have a history of Alzheimer's in our family, and it's a very devastating and tragic way for anyone's life to play out. For years, creatine has been boxed into the muscle supplement category, and yet the brain is one of the most energy demanding organs in the entire body, and it makes sense that researchers are exploring this. If larger trials do confirm significant benefits somewhere down the road, creatine would be one of the most inexpensive, accessible interventions ever studied in Alzheimer's, and that could certainly be a blessing to many, many people. The next decade in neuroscience is going to be very interesting to pay attention to, and my hope is that positive, meaningful developments lie ahead for all of us. If you want to know more about different aspects of creatine, you can check out the full series here. If you found this video helpful, let me know down in the comments. As always, thank you so much for watching. Please share this video with someone you feel would benefit from watching it as well. All the best to you. Be well, take care of yourself, and I will see you in the next video.